Assalamu alaikum. Good morning. My name is Fetal. I'm an intern, graduated from King Saud University for Health and Sciences, Jeddah. So our research title is Prevalence of Postpartum Depression using the Edinburgh Postnatal Depression Scale in Jeddah, Saudi Arabia. It's supervised by Dr. Abdulrahim Ghalib, Dr. Muhammad Khalid, and Dr. Faye. So to begin with, postpartum depression impacts many women by causing symptoms ranging from depressed mood to suicidal or even infanticidal ideation. And it also thought to affect newborn maturation due to mothers' negative and disengaged behavior. It's highly prevalent issue with some variability according to the region, and studies point to particular high prevalence in the Middle East. So, despite the high prevalence and negative consequences, there is no universal screening program in place to identify mothers with postpartum depression. Therefore, our aim was to assess prevalence of postpartum depression in the National Heart Hospital, Jeddah, and to establish efficient tool to screen perinatal depression among patients and determine the risk factor that can lead to postpartum depression. A secondary objective also is to approximate the risk factors associated with suicidal ideation. So our study is a cross-sectional study. We used a translated version of the Edinburgh Postnatal scale. So I will just give a quick overview about the scale. It's a 10-question scale. Each question has 4 multiple choices, and each question is scored from 0 to 3, so total score of 30. And the score should be done at least once and preferably twice for antenatal visit and postpartum period 6 weeks to 12 weeks. So to continue, we did the APDS scale by interviewing the women in the postnatal ward before their discharge. It was a 6-month period study. We included all the women in the postnatal ward, and we excluded women with carrying depressive disorders or psychological disorders. So we used the relative importance index to assess the most relevant indicators for postpartum depression for the APDS scale. So the results came as follows. We had total patients 308. The mean age was 29 plus and minus 5-year-old, and the median previous pregnancy was 2. So we used the multivariate regression analysis, which showed that prior admission to the NICU and then positive history of previous depressive disorder or marrying a polygamous husband, which means has more than one wife, all correlated significantly with odds of having postpartum depression. As you can see, the odds is 2.5 for NICU admission and 5.5 for prior history of depression and 3.6 for polygamous husband, all with significant p-value. And then suicidal ideations were screened using the question, the thought of harming myself has occurred to me. And then we did the regression analysis, and it showed that age and marrying to polygamous husband and answering or scoring 1 or more to question 2 and question 9 all correlated significantly with suicidal ideation, with odds ratio of 6.5 for polygamous and 2.7 for question 2 and 1.8. So we conclude we discussed that prevalence in our hospital is 32.6, which is high compared to another systematic review meta-analysis which showed that the prevalence in Jeddah was estimated to be 17%. And for the age alone was not statistically significant variable, but when we associated it with polygamous, younger women, especially younger than 30, had more risk to develop postpartum depression and even suicidal ideation. Lastly, the socio-demographics, such as the age alone and income and educational level, did not correlate significantly with postpartum depression. So we concluded that there is high prevalence of postpartum depression in the National Heart Hospital in Jeddah, and we recommend that organized screening programs should be done to screen women during their antenatal visit and also their postpartum to help like early intervention management along with psychosocial support. And thank you.
Thank you very much. It's impressive work. I didn't know that prevalence was so high. And there were 300 patients, so it's good sample size. Very good presentation. Congratulate you.
Excellent. I want really to say that I love the analysis part. It was amazing, really good.
Thank you so much.
Did you have a psychiatrist with you on this paper?
No, there is no psychiatrist with us.
And is there a psychiatric service in your hospital?
Yes, we can refer.
Okay, sorry.
Like the idea of us, if there's score high, we should like do referral to psychiatrist.
You should engage them in this kind of work. Yes.
Sometimes some of the journals will give turn back the journal if you don't have somebody who's specialized in this field. But it's an excellent point.
Yes, it's really good.
Thank you so much.
Thank you.
Actually, this scale now is used in national lab to establish, evaluate and establish the. It's in every antenatal sheet, and based on the scale, they
Okay.
communicate with psychiatrists.
Okay.
Very nice. So by this way, no patient will be missed because it's the part of the job.